that we will utilize to do the system here. Also, we would like to do a full complex. Okay, you see here, the picture here is just a basic concept design of the hospital structure itself. Where you see in the front is the emergency and outpatient wards. Then on the back three buildings are the wards for the humanitarian. Okay, with 150 beds each, a total of 500 beds. Also that goes along with this complex are a training facility that's going to train doctors and nurses. That training facility will have the accreditations. With the training facility, the reason we're going to do that also, it has to be one package. It all works together. Okay, so that way this whole system can work as one unit. Okay, and keep going forward with the cause in mind. Always the cause is the humanitarian effort. That's the reason that we're here. That's the reason that we're doing it. Is for the humanitarian purposes. Now, in partnership with Bulacan University, in partnership with us to implement that and make sure that it happens. Also, with that will be an aftercare facility. Okay. Now, that's going to be a 1,000 bed unit. You can change slides. Stop there. Okay. That'll be a 1,000 bed aftercare, meaning inside the hospital, you go in, you're sick, after surgery, okay, or after you're stabilized, you'll be transferred to another facility right there on the grounds also that will be a lower care there. Okay? That way we can utilize the hospital beds in the main hospital to treat as many people as we can. Okay, so then also along with that will be the pharmaceutical factory, okay, where we will produce pharmaceuticals that will sustain the hospital. Okay, so they can get free health care and free medication if it's needed. Okay. Also, along with that is the pharmaceutical factory, the training facility, and the aftercare. So it's a whole package. This is the basic concept design that we have. Okay, this is the whole of all the hospital itself and the three buildings that I had said to you. This project is, as we look at it now, is over $100 million US. So with that facility, there will be other supporting facilities that will be put there also. So, as I said, you're looking at over $100 million US. Okay. I have one more story for you, and this is personal experience here in the Philippines. We're doing two projects. One is the humanitarian hospitals, and the other one Dr. touched about is the feeding centers. Okay. This came into play. I'm from New York. I'm from the United States. My background is construction. That's what I've done my whole life. The first time that I came to the Philippines, I went on vacation in Bulacan. It was a beautiful place. Okay, and I was enjoying myself very much. I lived, I guess, a pretty sheltered life in the United States. There are a lot of things I never saw. Okay, until I came to the Philippines. So, on my vacation in Bulacan, I'm sitting on the beach at a nice buffet, relaxing, enjoying my dinner. Okay. And a couple of young boys came by, okay? And you can tell they were local boys. They were very dirty. And they were in ragged clothes. One of the other foreigners that was there, another tourist, gave the kids a ticket for the buffet. They hadn't paid for it. So it wasn't free. They paid for the ticket and they gave it to the two boys and told them to eat. Now the buffet was out on the beach. It wasn't inside one of the fancy hotels that they had to walk in through the dining room, okay? It was out on the beach. Security guard came right away and told the two boys to get out of here, go away. And they took the ticket from them. So I walked over to the manager of the hotel who was standing out there so proud in front of the buffet that he had such a nice spread of food. And I said to him, why did they tell those kids to leave? Their meal was paid for, just like anyone else that was there. Why weren't they allowed to eat? He said, because they're locals and they bother the tourists. I couldn't fathom this. I couldn't understand that those kids were hungry, okay, and they weren't allowed to eat. Even though the meal had been paid for, they weren't allowed to eat, okay? I couldn't understand this. So I had said to the manager of the hotel, what do you do with the food that's left over after your buffet? He said, it's thrown in the garbage. So many locals there in Bulacan And I went on a scooter, I rented a scooter with some friends, and we drove the island, and we went all over. We didn't just stay on the main place, we went all over the island. And you can see all the locals there. There was so much money on the island. People on vacation, spending money, eating, luxury hotels, and all these things. Yet, the local people there are starving. Makes no sense. All it takes is a little bit of effort from people, a little compassion, a little caring about their fellow man. There's no reason that those hotels couldn't collect the food and send it someplace so the locals could eat it. So I couldn't understand. So then when I came to Manila, after that, I've been here now 3 years. When I came to Manila after my vacation in Boracay, and I walked around in the streets and took taxis around and saw the poverty that was here. Okay, that's the reason that I got involved in this, is because in good conscience I couldn't look and see what was going on and not do something about it, not try to do something about it. How could you not? There are people out there that are starving. On the way here to this meeting, we drove through the squatter areas in Tondo and see all the misery that's there, and people hungry, and the way that they're living. And know that if they get sick and something happens to them, they have nowhere to go to get treatment. They go to the public hospitals that are here, and the way they're designed now is you're lucky if you come out of one of those public hospitals alive. To go in for minor things that are wrong, you might not come back out again. Okay? I had a friend of mine in the condo that I live in. She was a local girl, and she went out with her friends for a ride on a scooter, and a bus hit her, and she cracked her head open. She wasn't wearing a helmet. So now, they take her to the local hospital. She died there, waiting for the hospital to find out who was going to pay for the hospital bills. Okay? So while they were waiting to see who was going to be financially responsible, she died. Okay? These things should not happen. They shouldn't happen in a society, or any society, where there are ways and things that can be done to stop this. So we owe it to each other to do something about these situations. And that's the reason that we're here. We're not here to make money. We're not here to get rich. We're not here for any of these reasons. We are here to do humanitarian work. We are here for the good of the people. Okay, we're a non-profit organization, like the Red Cross, just to do good works that need to be done. So as you think about the proposal that we put out to you today, just keep those things in mind. So again, as this proposal goes forward, that's the things that I want you to think about as they ask you, do you want to participate in this? Okay, thank you. Thank you for your time.